Now, a study by the KNUST School of Medical Sciences has found many mothers are dissatisfied with labor and delivery services provided by health facilities in the country. The research revealed 74% of women find it difficult accessing toilet facilities and ambulance services. Lava FM's Kwesi Deborah has more in the following report.
8-month-old Eric Ajman is having some time on her mother's laps. His health has so far been good. His mother, Elizabeth, recalls her fond experience during labor at a private hospital. It was the first time I stepped in that hospital, she says. The nurses were good. They pampered me. They were all around me, comforting me before and after I delivered. Abiba Ishaq, however, has a different story, especially with her last child. I went to a government facility. Unfortunately, I couldn't bring along my towel. I wanted them to help me out, but the birth attendants wouldn't mind me. They said all sorts of words to me. I had to make a call to the house before I could get one. The WHO defines quality of care as the extent to which healthcare services provided to individuals and patient populations results in a desired outcome. However, one's perception of quality service and hence expressed satisfaction may not necessarily be the standard of quality care. Dr. Jacopoku is director, South Central Hospital.
People who are in the act of baby deliveries or birth attendants at our hospital should recognize that traditionally, women who are going to deliver by women expect nothing more than 100% services.
For the study, 223 mothers who delivered within the last 5 years were interviewed.
My research topic was on maternal satisfaction with the quality of labor and delivery services in the Ladade-Kotopon district in the Greater Accra region. And I realized that from my study, 74% of the women were dissatisfied with the services provided, especially with the accessibility to the toilet and shower facility, and also with the ambulance services. Most of the women were complaining that where the shower and toilet facilities were far away from the labor ward, and also most complaining that when it was time for them to deliver and labor sets in at home, they don't have the ambulance services to bring them to the hospital.
The study also found women who stayed longer at the hospital were more satisfied than those who had a shorter stay.
The reasons could be as a result of the fact that those who stayed longer at the hospital were attended to more often, whereas those who were discharged early went home with complications unattended.
Dr. Gracelyn believes it's about time Ghana upholds the WHO quality of care, which advocates an efficient, equitable and safe level of patient-centeredness. Reporting for JoyNews, Kwesi Deborah.
We've been joined on the line by the lead researcher, Dr. Gracelyn Asare. Hello, Doc. Thank you so much for your time. Hello, Doc.
Yeah, hello, good morning.
Good morning. Thank you so much for joining us. Now, you say that in your research you identified that most women opt for C-section. What's so wrong about that?
Okay, considering delivery, there are two options. Either you deliver vaginally or go by cesarean section. Even though cesarean section is very safe and then very cheap, I realized from my study that most of the mothers were satisfied with the cesarean section. From that particular study, I didn't actually find out why, but I presume that with cesarean section, they believe that they have more contact with the doctor and then the midwife. Because from that same study, most of them were satisfied with the fact that they had contact with both a physician and then a midwife.
Sorry to cut in, but how does that well, what does that say about our health sector? Is that a negative or positive thing that most women will opt for C-section, even if it's not recommended by a doctor?
It's usually when the mother or the fetus is at risk that a cesarean section is indicated. But in current times, mothers are opting for cesarean section because they feel that it will cut down on their labor fears and anxiety because of the prolonged hours of labor. So they would wish to cut down on that hours of labor and then the pain during labor. With cesarean section, adequate analgesia is provided. That's pain medication is provided to relieve the woman of any pain that she may be going through, which may be very traumatizing. So they would wish.
Okay. Doc, apologies, I had to cut in there. You recommend that we focus on the WHO quality of care. How do you suggest we do that for our general health system?
With the WHO quality of care, as stated earlier on, care should be safe, efficient, effective, timely, and then so with it being safe, so it means that we would want to reduce every risk that would endanger the mother or the fetus.
So how do we get there? How do you suggest that we get there as a country with our health system?
I think there should be less talk and more action. We usually talk about providing facilities to improve on our health sector. And nothing is being done about it. Much is not being done about it. But elsewhere, they have the facilities to monitor each patient. Each patient has a monitor. And if this is to go on, I think it would really, really help our health sectors if they provide the necessary equipment and monitors needed to monitor patients. And then the attitude to workers, if we all work on our attitude, going to work early, punctuality, seeing to it that what the task we've been given is being done well, instead of being apathetic at work.
Thank you very much. Okay, finally, quickly, sorry.
Okay.
Please continue what you were saying.
Yeah, I was talking about attitude, that instead of being apathetic at work, everyone is supposed to do that and do it on time, then we would help the patient and help ourselves and then our colleagues as well.
We really appreciate your time this morning. Gracelyn Asare is lead researcher there, finding out that about 74% of women in Ghana are dissatisfied with labor services. But coming up in business, we explore the high cost of importing livestock and poultry products as Ghana spends over $300 million annually on chicken imports alone. Do stay.